Hi, my name is Dr. Meghan Dukes-Rodriguez, and my client's name is Zack Bergen. Zack is 27 years old. This week I will be covering narcissistic personality disorder. There are two differential diagnoses: narcissistic personality disorder, which was ruled in, and histrionic personality disorder was ruled out because criterion 5 and 8 were not met. Narcissistic personality disorder has one primary diagnostic feature: a lifelong pattern of grandiosity, need for admiration, a lack of empathy, which manifests into a sense of entitlement, belief in one's specialness, and arrogance behaviors and attitudes. Zack's story. Zack is a 27-year-old man who was referred for psychiatric evaluation by his physician because Zack told him that he was very depressed and feared that he might kill himself. Zack turns up for his appointment 15 minutes late, dressed in what appears to be a very expensive suit, complete with a silk pocket square and Italian leather loafers. He enters the office dramatically exclaiming, "What a gorgeous day outside. I can't believe I'm coming inside for a meeting." When asked why he is late, he replies laughingly, "Am I? I believe that I'm well worth the wait." He explained that he's only come to this appointment to get his family doctor off of his back. For some reason, he's concerned about me. He then takes control of the interview and begins to talk about himself. After first remarking, half-jokingly, "I was hoping that you would be as attractive as my family doctor." Zack brought with him a briefcase, which he opens up and turns around to reveal the contents to the therapist. Inside are his resume, headshots of himself, pictures of him with various celebrities, and a stack of DVDs labeled "The Story of Me." He used these items to introduce himself to the therapist. He explained that in the last few years, he has been working to become a celebrity. When asked what he wants to be famous for, he replies, "I want to be famous for being myself. But this town requires that I have some talent, so I'm going to be a famous actor." Zack has no previous acting experience, but he is sure that success is only a question of time. He pulls out some promotional material about himself and states, "I know once casting agents get a look at me, they won't be able to resist hiring me on the spot. I'm too good to pass up." When asked about his love life, Zack explains that he is gay and that he currently is not in a relationship. He did date a man semi-seriously for a few months recently, but he called it quits when he became disgusted with him, he states. "He simply was not up to my standard. He dressed far too casually all the time, and he didn't have manners. Quite frankly, he was an embarrassment. The sex was great, but that was not enough for me to ignore his numerous shortcomings." He has decided to take a break from dating because he is sick of interacting with men who are beneath him. He has decided to wait until someone worthy of his love comes along. In the meantime, he is going to focus all of his attention on becoming a celebrity. When asked about his family history, Zack reports that he believes that he has to have been adopted because "there's no way I'm genetically related to my parents. My father was a good-for-nothing drunk who couldn't keep his pants on, and my mother was a pathetic doormat who constantly whined. I got the heck out of there the minute that I turned 18. Zack also shared he had a tortured time in junior and senior high. He was picked on for being gay and for having a slight build. He explains that once he started bodybuilding, the bullying stopped. When I graduated from high school, I got the heck out of there, and I've never looked back. They were all jealous of me, as they should have been, so I can't really blame them for trying to keep me down. That's it for the story of Zack Bergen and narcissistic personality disorder. Thank you.